Question 1. Investigation of a client presenting with profound grief following the loss of a spouse, who also discloses a history of significant childhood trauma that is resurfacing with the current loss, requires careful consideration of the interplay between these experiences. The Certified Grief Counselor, GCC, must determine the most appropriate initial course of action to support the client effectively and ethically. Option A. Recommend immediate referral to a trauma specialist, explaining that the counselor's expertise is limited to grief counseling. Option B. Focus solely on the grief process, acknowledging the trauma but deferring specific trauma interventions until the immediate grief is more stabilized. Option C. Immediately initiate trauma-informed therapeutic techniques to address the resurfacing childhood trauma, integrating it into the grief counseling process. Option D. Gently explore the client's current feelings about the loss and their immediate distress, while also acknowledging the connection to their past trauma and offering to collaboratively develop a plan that may involve specialized support. The correct answer is C. Immediately initiate trauma-informed therapeutic techniques to address the resurfacing childhood trauma, integrating it into the grief counseling process. Explanation. This scenario presents a professional challenge due to the complex interplay of trauma, grief, and the counselor's ethical obligations. The client's history of trauma significantly complicates their grief process, potentially leading to re-traumatization, if not handled with extreme sensitivity and expertise. The counselor must navigate the client's immediate emotional distress, while also considering the long-term impact of unresolved trauma on their ability to process loss. Careful judgment is required to balance immediate support with the need for specialized trauma-informed interventions. The correct approach represents best professional practice because it prioritizes the client's safety and well-being by acknowledging the trauma's influence on their grief. This aligns with the Certified Grief Counselor, GCC, ethical code, which mandates that counselors practice within their scope of competence and seek appropriate consultation or referral when dealing with issues beyond their expertise, particularly those involving trauma. It also reflects a commitment to a client-centered approach, tailoring interventions to the individual's unique needs and experiences, which is a cornerstone of ethical grief counseling. An incorrect approach that involves immediately delving into the specifics of the traumatic event without adequate preparation or assessment would be a significant ethical failure. This could lead to re-traumatization, overwhelming the client and potentially causing further psychological harm, violating the principle of do no harm. Another incorrect approach, such as minimizing the client's trauma and focusing solely on the grief, would be a failure to recognize the interconnectedness of trauma and grief, thereby providing incomplete and potentially ineffective support. This neglects the client's holistic experience and could lead to the perpetuation of unresolved trauma symptoms. A third incorrect approach, such as abruptly terminating services due to the complexity of the trauma, would be an abandonment of the client, failing to provide appropriate referrals or support in transitioning care, which is an ethical breach. Professionals should employ a decision-making framework that begins with a thorough assessment of the client's presenting issues, including the nature and impact of both the trauma and the grief. This assessment should inform the development of a treatment plan that is trauma-informed and grief-sensitive. When faced with complex cases involving trauma, seeking supervision or consultation with specialists in trauma therapy is crucial. The counselor must continuously evaluate the client's progress and adjust interventions as needed, always prioritizing the client's safety, autonomy, and therapeutic goals. Question 2. What factors determine the most effective integration of clinical interview techniques and observational methods when assessing a client's grief process, ensuring both comprehensive information gathering and client-centered care? Option A. The counselor's primary focus on eliciting detailed factual information about the loss event, prioritizing data collection over the client's immediate emotional comfort. Option B. The counselor's predetermined theoretical orientation, which dictates the specific questions asked and the observations made, irrespective of the client's unique grief experience. Option C. The counselor's adherence to a standardized interview protocol, regardless of the client's immediate emotional state or willingness to disclose. Option D. The client's expressed emotional readiness and nonverbal cues, alongside the counselor's ability to adapt questioning and observation based on these indicators. The correct answer is D. The client's expressed emotional readiness and nonverbal cues, alongside the counselor's ability to adapt questioning and observation based on these indicators. Explanation. This scenario presents a professional challenge because the Certified Grief Counselor, GCC, must navigate the delicate balance between gathering essential clinical information and respecting the client's autonomy and emotional state during a grief process. The effectiveness of clinical interviews and observational techniques is directly impacted by the client's readiness to disclose, their current emotional capacity, and the counselor's ability to create a safe and trusting environment. The GCC must exercise careful judgment to avoid re-traumatizing the client or imposing an agenda that is not aligned with the client's needs. The correct approach emphasizes a client-centered methodology, where the pace and depth of the interview are dictated by the client's cues and expressed comfort level. This aligns with ethical guidelines for grief counseling, which prioritize the client's well-being and self-determination. By employing open-ended questions, active listening, and non-judgmental observation of nonverbal communication, the counselor can build rapport and facilitate genuine disclosure. This approach respects the inherent variability in grief experiences and acknowledges that progress is not linear. It is considered best professional practice because it fosters a therapeutic alliance, allows for a more accurate assessment of the client's needs, and empowers the client in their healing journey. An incorrect approach that focuses solely on extracting specific details about the loss event without regard for the client's emotional state would be a significant ethical failure. This could be perceived as intrusive, insensitive, and potentially re-traumatizing, violating the principle of do no harm. Another incorrect approach that relies exclusively on predetermined checklists or rigid questioning patterns, ignoring the client's unique narrative and emotional responses, would fail to acknowledge the individuality of grief. This demonstrates a lack of clinical flexibility and an inability to adapt to the client's present needs, potentially leading to an incomplete or inaccurate assessment. Furthermore, an approach that prioritizes the counselor's theoretical framework over the client's lived experience would be a misapplication of professional judgment, as the client's subjective reality must guide the therapeutic process. The professional decision-making process for similar situations should involve a continuous assessment of the client's verbal and nonverbal cues. The GCC should ask themselves, is the client showing signs of distress or withdrawal in response to this line of questioning? Am I creating a safe space for them to share at their own pace? Are my observations informing my next steps, or am I rigidly following a plan? This iterative process of observation, reflection, and adaptation ensures that the interview remains a supportive and effective tool for facilitating grief work. 3. When evaluating a client's grief response, which approach best reflects a comprehensive and ethically sound risk assessment for a certified grief counselor, GCC? Option A. Prioritizing a thorough assessment of the client's cultural background, personal history, and the specific nature of their loss, while integrating insights from various grief theories and remaining flexible to adapt interventions based on the client's evolving needs and responses. Option B. Focusing primarily on identifying and modifying maladaptive thought patterns and behaviors related to the loss, utilizing cognitive behavioral techniques as the sole therapeutic modality. Option C. Strictly adhering to a well-established grief model, such as the 5 stages of grief, to guide the assessment and intervention process, ensuring the client is progressing through each stage in a predictable manner. Option D. Emphasizing the counselor's preferred theoretical orientation and applying its principles consistently to all clients, regardless of their individual circumstances or cultural context. The correct answer is A. Prioritizing a thorough assessment of the client's cultural background, personal history, and the specific nature of their loss, while integrating insights from various grief theories and remaining flexible to adapt interventions based on the client's evolving needs and responses. Explanation. This scenario presents a professional challenge due to the inherent complexity of grief, the potential for misinterpreting a client's coping mechanisms, and the ethical imperative to provide appropriate, evidence-based support. A certified grief counselor, GCC, must navigate the nuances of individual grief experiences while adhering to professional standards and ethical guidelines. Careful judgment is required to avoid imposing theoretical frameworks rigidly and to ensure interventions are client-centered and culturally sensitive. The correct approach represents best professional practice because it prioritizes a comprehensive assessment that considers the client's unique context, including their cultural background, personal history, and the specific nature of their loss. This aligns with the GCC's ethical obligation to provide competent and individualized care. By integrating multiple theoretical perspectives and remaining open to the client's evolving needs, the counselor demonstrates a commitment to a flexible, client-led therapeutic process, which is foundational to effective grief counseling. This approach respects the individuality of grief and avoids premature diagnostic labeling or the application of a one-size-fits-all intervention. An incorrect approach that focuses solely on a single, prescriptive grief model, such as Kubler-Ross's stages of grief, fails to acknowledge the non-linear and highly personal nature of grief. This rigid application can lead to misinterpreting a client's experience if they do not progress through the stages in a predictable manner, potentially causing distress or a sense of failure for the client. Ethically, this approach violates the principle of client autonomy and individualized care. Another incorrect approach that relies exclusively on a purely cognitive behavioral framework, without acknowledging the emotional and existential dimensions of grief, would be professionally inadequate. While cognitive and behavioral strategies can be helpful, grief is a multifaceted experience that often involves profound emotional processing and existential questioning. Overlooking these aspects can result in superficial interventions that do not address the client's deeper needs. This failure to provide holistic care is an ethical concern. A third incorrect approach that prioritizes the counselor's theoretical preferences over the client's expressed needs or cultural context is also ethically problematic. The GCC has a duty to practice within their scope of competence and to respect the client's cultural values and beliefs. Imposing a theoretical lens that is not congruent with the client's worldview or that pathologizes their natural grieving process is a violation of ethical practice. The professional decision-making process for similar situations should involve a continuous cycle of assessment, intervention, and evaluation. Counselors should begin by conducting a thorough biopsychosocial and spiritual assessment, considering the client's cultural background, support systems, and coping styles. They should then draw upon a range of theoretical frameworks, selecting and adapting interventions that are most appropriate for the individual client's needs and goals. Ongoing monitoring of the client's progress and willingness to adjust the therapeutic approach based on the client's feedback are crucial. This iterative process ensures that the counseling remains client-centered, ethically sound, and effective. Question 4. Strategic planning requires a certified grief counselor, GCC, to consider the multifaceted impact of a recent parental death on a family consisting of a surviving spouse, 2 teenage children, and an elderly grandparent living in the home. Which of the following approaches best guides the GCC's initial strategy for supporting this family? Option A. Focus on providing educational materials about the stages of grief to the family, expecting them to self-direct their healing process based on this information. Option B. Prioritize immediate grief counseling sessions focused solely on the surviving spouse, assuming their grief is the primary concern and will indirectly support the rest of the family. Option C. Conduct a comprehensive family assessment to understand each member's individual grief response, their relational dynamics, and the family's existing coping mechanisms and support systems before developing a tailored intervention plan. Option D. Implement a standardized grief support group curriculum for all family members simultaneously, assuming a uniform experience of loss and a shared need for identical interventions. The correct answer is C. Conduct a comprehensive family assessment to understand each member's individual grief response, their relational dynamics, and the family's existing coping mechanisms and support systems before developing a tailored intervention plan. Explanation. Scenario analysis. This scenario is professionally challenging because it involves navigating the complex and often intertwined grief experiences of multiple family members. The certified grief counselor, GCC, must recognize that each individual within a family unit will process loss differently, influenced by their unique relationship with the deceased, their personal coping mechanisms, and their existing family dynamics. A one-size-fits-all approach is ineffective and potentially harmful. The counselor needs to assess the family's collective grief response, while also acknowledging and addressing individual needs, ensuring that interventions are sensitive to the family's cultural background, communication styles, and existing support systems. Correct approach analysis. The correct approach emphasizes a holistic and individualized assessment of the family's grief. This aligns with the ethical principles of client-centered care and the understanding that grief is a multifaceted process. By prioritizing a comprehensive assessment that considers both individual and family dynamics, the GCC can develop a tailored intervention plan. This approach respects the autonomy of each family member and acknowledges the interconnectedness of their grief experiences. It also allows for the identification of potential family conflicts or communication breakdowns that may be exacerbated by the loss, enabling the counselor to address these issues proactively and supportively. This aligns with the GCC's responsibility to provide competent and ethical care, which necessitates understanding the unique context of each client system. Incorrect approach is analysis, an approach that solely focuses on the surviving spouse's grief, while important, fails to acknowledge the impact of the loss on other family members, such as children or extended family. This can lead to unmet needs and unresolved grief for those individuals, potentially creating further family distress. Ethically, this approach is deficient as it does not provide comprehensive care to the entire family unit as a system. An approach that assumes all family members are experiencing the same type and intensity of grief is a significant misjudgment. Grief is highly individualized. This assumption can lead to the overlooking of specific needs, the misinterpretation of behaviors, and the implementation of inappropriate interventions, potentially alienating family members and hindering their healing process. This violates the ethical principle of providing individualized care, an approach that immediately implements standardized grief counseling techniques without prior assessment risks being ineffective or even counterproductive. Grief is not a uniform experience, and applying generic strategies without understanding the family's specific context, cultural nuances, and individual coping styles can be perceived as insensitive and may not address the root causes of their distress. This demonstrates a lack of professional due diligence and a failure to adhere to best practices in grief counseling. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough assessment. This involves gathering information about the deceased, the circumstances of the death, the family's history, their relationships, their cultural background, and their current coping mechanisms. Following assessment, the counselor should collaboratively develop an intervention plan with the family, setting clear goals and objectives. Regular evaluation of the plan's effectiveness and flexibility in adapting interventions based on the family's evolving needs are crucial. This iterative process ensures that the care provided is both ethical and effective, respecting the unique journey of each family through grief. Question 5. System analysis indicates that a certified grief counselor, GCC, is presented with a client who expresses profound sadness, anger, and a sense of disbelief following the recent death of a spouse. The client states, "I just want this feeling to go away, like it's just a bad dream I can wake up from." The GCC must determine the most appropriate conceptualization of the client's experience to guide their support. Which of the following best defines grief in this context, according to the principles guiding certified grief counselors? Option A. A singular emotional reaction to a loss that is best managed by distraction and focusing on practical matters to avoid dwelling on painful feelings. Option B. A complex, individualized, and multidimensional process of adjustment to loss, encompassing a wide range of emotional, cognitive, behavioral, social, and spiritual responses that unfold over time without a predetermined endpoint. Option C. A temporary emotional state characterized primarily by sadness and depression that can be resolved through positive affirmations and advice to move on quickly. Option D. A predictable sequence of distinct stages, such as denial, anger, bargaining, depression, and acceptance, that all individuals must experience in a specific order to successfully process a loss. The correct answer is B. A complex, individualized, and multidimensional process of adjustment to loss, encompassing a wide range of emotional, cognitive, behavioral, social, and spiritual responses that unfold over time without a predetermined endpoint. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a certified grief counselor, GCC, to apply a nuanced understanding of grief within the specific regulatory and ethical framework governing their practice. The GCC must differentiate between a client's immediate emotional distress and the broader, more complex process of grief, ensuring their interventions are appropriate and aligned with professional standards. Misinterpreting the definition of grief could lead to misdiagnosis, ineffective support, and potential harm to the client. Correct approach analysis. The correct approach aligns with the GCC's professional mandate to understand and support clients through the multifaceted experience of grief. This involves recognizing grief not merely as a singular emotion, but as a dynamic, individualized process encompassing cognitive, emotional, behavioral, social, and spiritual dimensions. The GCC's role is to facilitate the client's navigation of this process, acknowledging its unique trajectory and the absence of a universal timeline or prescribed outcome. This approach is ethically sound as it prioritizes client-centered care, respects individual differences, and avoids imposing external expectations on the grieving process, which is consistent with the ethical guidelines for grief counseling that emphasize empathy, non-judgment, and professional competence. Incorrect approach is analysis. One incorrect approach would be to define grief solely as a period of intense sadness or depression following a loss. This is a significant regulatory and ethical failure because it oversimplifies the complex nature of grief, reducing it to a single emotional state. This narrow definition can lead to premature termination of support if the sadness subsides, failing to address other crucial aspects of the grieving process such as anger, bargaining, or acceptance, and potentially overlooking the long-term impact of the loss. It also risks pathologizing normal grief reactions by framing them solely within a diagnostic lens of depression, which is not the primary function of a grief counselor. Another incorrect approach would be to view grief as a linear, predictable sequence of stages that all individuals must pass through in a specific order. This is a regulatory and ethical failure because it imposes an artificial and often inaccurate model onto the client's unique experience. Adhering to such a rigid framework can invalidate a client's feelings and experiences if they do not conform to the prescribed stages, leading to feelings of failure or abnormality. It also fails to acknowledge the cyclical, non-linear, and highly individual nature of grief, which is a core tenet of modern grief theory and ethical practice. A third incorrect approach would be to equate grief with a temporary emotional reaction that can be quickly resolved with simple advice or distraction. This is a regulatory and ethical failure as it fundamentally misunderstands the depth and duration of grief. Grief is a profound adjustment to loss, not a fleeting emotion. This approach neglects the client's need for sustained support, validation, and exploration of their loss. It can lead to the client feeling unheard, dismissed, and unsupported, potentially exacerbating their distress and hindering their ability to adapt to their new reality. Professional reasoning. Professionals should employ a decision-making framework that begins with a thorough assessment of the client's presenting concerns, considering the context of their loss. This assessment should be guided by an understanding of grief as a complex, multidimensional, and individualized process. The GCC must then consult relevant professional guidelines and ethical codes to ensure their conceptualization of grief and subsequent interventions are aligned with best practices. This involves recognizing that grief is not a pathology to be cured but a natural human response to loss that requires support and facilitation. When faced with ambiguity, seeking supervision or consultation with experienced colleagues is a critical step to ensure ethical and effective practice. Question 6. Cost-benefit analysis shows that while cognitive behavioral theories offer structured interventions for managing distress, a certified grief counselor, GCC, must carefully consider the unique nature of grief when applying these frameworks. Which of the following approaches best reflects a nuanced and ethically sound application of CBT principles in grief counseling? Option A. Utilizing CBT techniques primarily to encourage the client to intellectualize their grief and detach from emotional engagement with the loss. Option B. Applying standard CBT interventions without significant adaptation, assuming that grief can be treated as a form of anxiety or depression. Option C. Prioritizing the identification and modification of maladaptive thoughts and behaviors that impede the client's ability to function in daily life, while remaining sensitive to the client's emotional processing and allowing for the expression of a wide range of grief-related feelings. Option D. Implementing a strict, time-limited CBT protocol focused on rapidly eliminating all negative emotions associated with the loss to promote immediate functional recovery. The correct answer is C. Prioritizing the identification and modification of maladaptive thoughts and behaviors that impede the client's ability to function in daily life, while remaining sensitive to the client's emotional processing and allowing for the expression of a wide range of grief-related feelings. Explanation. This scenario presents a professional challenge because a certified grief counselor, GCC, must navigate the ethical and practical implications of applying cognitive behavioral theories to a client experiencing profound grief. The challenge lies in balancing the structured, goal-oriented nature of CBT with the often non-linear, deeply emotional, and existential experience of grief. A GCC must ensure that interventions are sensitive to the client's unique grieving process, avoiding premature or overly directive approaches that could invalidate their feelings or hinder their natural adaptation. The correct approach represents best professional practice because it prioritizes a client-centered application of CBT principles, recognizing that grief is not a disorder to be cured, but a process to be navigated. This approach aligns with the ethical guidelines for grief counseling, which emphasize empathy, respect for individual differences, and the importance of a therapeutic alliance. By integrating CBT techniques such as cognitive restructuring and behavioral activation in a flexible and responsive manner, the GCC can help the client identify unhelpful thought patterns and engage in meaningful activities without imposing a rigid agenda. This respects the client's autonomy and acknowledges the multifaceted nature of grief, which may involve acceptance, meaning-making, and continued connection with the deceased. An incorrect approach that focuses solely on rapid symptom reduction through aggressive cognitive restructuring would fail to acknowledge the validity and necessity of the client's emotional experience. This could lead to the client feeling invalidated, misunderstood, or pressured to suppress their grief, potentially hindering long-term adaptation and increasing the risk of complicated grief. Ethically, this approach could be seen as a failure to provide appropriate care, potentially violating principles of beneficence and non-maleficence by causing distress or harm. Another incorrect approach that strictly adheres to a manualized CBT protocol without adaptation to the grief context would be equally problematic. Grief is highly individualized, and a one-size-fits-all application of CBT techniques may not address the specific existential questions, spiritual concerns, or relational losses that are central to the grieving process. This could result in a therapeutic relationship that feels impersonal and ineffective, failing to meet the client's unique needs and potentially leading to disengagement from therapy. This would represent a failure to provide competent and individualized care. Professionals should employ a decision-making framework that begins with a thorough assessment of the client's grief experience, including their emotional, cognitive, behavioral, and existential responses. This assessment should inform the selection and adaptation of therapeutic interventions. A collaborative approach, where the client is an active participant in setting goals and choosing strategies, is crucial. Professionals must continuously monitor the client's response to intervention, remaining flexible and willing to adjust their approach based on the client's feedback and evolving needs. This iterative process ensures that the application of CBT remains ethical, effective, and aligned with the client's journey through grief. Question 7. Process analysis reveals that a certified grief counselor, GCC, is working with a client who, following a recent significant loss, is exhibiting extreme agitation, expressing suicidal ideation, and reporting an inability to cope with daily functioning. The counselor recognizes this as a critical crisis point. Which of the following represents the most appropriate initial intervention based on crisis theory and professional ethical standards for grief counseling? Option A. Immediately engage in deep exploration of the client's past grief experiences to identify root causes of their current distress. Option B. Provide the client with a list of general coping strategies for grief and encourage them to try these independently. Option C. Advise the client to seek immediate psychiatric hospitalization without further assessment of their immediate safety or available support systems. Option D. Focus on de-escalating the immediate crisis by ensuring safety, validating the client's intense emotions, and collaboratively developing a short-term plan to manage immediate needs and risks. The correct answer is A. Immediately engage in deep exploration of the client's past grief experiences to identify root causes of their current distress. Explanation. Scenario analysis. This scenario presents a professional challenge because a grief counselor is tasked with intervening in a crisis situation where the individual's immediate safety and psychological stability are compromised. The urgency of a crisis, coupled with the inherent vulnerability of someone experiencing profound grief, demands a rapid, yet carefully considered response. The counselor must balance immediate intervention with the long-term therapeutic goals of grief work, all while adhering to professional standards and ethical guidelines. The challenge lies in accurately assessing the crisis level and selecting an intervention that is both effective in de-escalating the immediate distress and supportive of the client's ongoing grief process, without overstepping professional boundaries or causing further harm. Correct approach analysis. The correct approach involves a structured crisis intervention that prioritizes immediate safety and stabilization. This aligns with the core principles of crisis theory, which posits that individuals in crisis are in a state of disequilibrium and are more receptive to help. A key element is active listening and validation of the client's feelings, which helps to build rapport and reduce immediate distress. The intervention should focus on identifying the precipice of the crisis, exploring coping mechanisms, and collaboratively developing a plan to address immediate needs. This approach is ethically sound as it demonstrates a commitment to client welfare and safety, adhering to the principle of beneficence. It also respects the client's autonomy by involving them in the solution, even within the constraints of a crisis. Regulatory frameworks for grief counseling emphasize the importance of appropriate intervention for acute distress, ensuring that counselors are equipped to handle such situations responsibly. Incorrect approaches analysis. One incorrect approach would be to immediately attempt to process the deep-seated grief without first addressing the acute crisis. This fails to acknowledge the principles of crisis theory, which dictate that immediate stabilization is paramount before deeper therapeutic work can be effective. Ethically, this could be seen as a failure to provide appropriate care, potentially exacerbating the client's distress and putting them at further risk. Neglects the immediate need for safety and support, violating the principle of non-maleficence. Another incorrect approach would be to refer the client to emergency services without a thorough assessment of the immediate crisis level and the client's capacity to engage with alternative support. While referral is sometimes necessary, an immediate, unassessed referral can feel dismissive to the client and may not be the most appropriate level of care. This could be a regulatory failure if it bypasses established protocols for crisis intervention within the scope of grief counseling practice. It also fails to demonstrate the counselor's own capacity to manage the crisis effectively, potentially undermining the therapeutic relationship. A third incorrect approach would be to offer generic advice or platitudes without actively listening or validating the client's experience. This is ineffective in a crisis because it does not address the client's immediate emotional state or provide a sense of being heard and understood. Crisis theory emphasizes the importance of a supportive and empathetic presence. This approach would be ethically problematic as it represents a lack of professional engagement and could be perceived as abandonment or a failure to provide competent care. Professional reasoning. Professionals should employ a decision-making process that begins with a rapid assessment of the crisis. This involves understanding the precipitating event, the client's current state of distress, and their available support systems. Following assessment, the counselor should prioritize safety and stabilization, utilizing active listening, validation, and collaborative problem-solving. If the crisis exceeds the counselor's scope of practice or poses an immediate danger, a carefully considered referral to appropriate emergency services or higher levels of care should be made, ensuring continuity of care. Throughout the process, maintaining ethical boundaries and adhering to regulatory guidelines for crisis intervention in grief counseling is essential. Question 8. Quality control measures reveal that a certified grief counselor, GCC, is working with a client who has been using excessive social media engagement as a primary way to avoid confronting their grief. The GCC's internal assessment suggests this behavior may be impeding the client's progress in processing their loss. Which of the following represents the most ethically and humanistically aligned approach for the GCC to take in this situation? Option A. Directly confront the client, stating that their reliance on social media is a clear sign of avoidance and is preventing them from truly grieving. Option B. Advise the client that their extensive social media use is unhealthy and suggest they immediately reduce their screen time to focus on more traditional grief processing methods. Option C. Focus solely on other aspects of the client's grief journey, ignoring the social media engagement as it is not a direct expression of their internal emotional state. Option D. Gently inquire about the client's feelings and experiences related to their social media use, exploring what meaning or comfort they derive from it, and observing if the client expresses any desire to explore alternative ways of coping or processing their grief. The correct answer is D. Gently inquire about the client's feelings and experiences related to their social media use, exploring what meaning or comfort they derive from it, and observing if the client expresses any desire to explore alternative ways of coping or processing their grief. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified grief counselor, GCC, to navigate the delicate balance between client autonomy and the ethical imperative to provide effective support, particularly when a client's chosen coping mechanism may be hindering their grief process. The GCC must assess the client's readiness for deeper exploration without imposing their own agenda or judgment, adhering strictly to the humanistic principle of unconditional positive regard, while also ensuring the client's well-being. Correct approach analysis. The correct approach, focusing on exploring the client's feelings and experiences related to their chosen coping mechanism without judgment, aligns directly with humanistic principles. This approach honors the client's agency and self-determination, core tenets of humanistic psychology. By creating a safe and non-directive space, the GCC facilitates the client's own exploration and insight development, which is crucial for genuine healing. This respects the client's unique journey and avoids pathologizing their current coping strategies, which is essential for building trust and rapport within the GCC's ethical framework. The GCC's role is to facilitate, not to dictate, the grief process. Incorrect approach is analysis, an approach that immediately suggests alternative coping strategies without first understanding the client's current experience and the meaning they derive from it, fails to uphold the humanistic principle of client-centeredness. It risks invalidating the client's current efforts and can be perceived as judgmental, undermining the therapeutic alliance. This approach bypasses the client's internal process and imposes an external solution, which is contrary to humanistic ideals of empowering the client to find their own path. Another incorrect approach would be to directly challenge the efficacy of the client's coping mechanism, framing it as detrimental. This is judgmental and directive, violating the humanistic commitment to unconditional positive regard. Such an approach can lead to defensiveness and resistance, hindering the client's willingness to engage in deeper therapeutic work. It also assumes the GCC has superior insight into the client's grief process, which is antithetical to the humanistic belief in the client's inherent capacity for growth and self-understanding. Finally, an approach that dismisses the client's coping mechanism as irrelevant to their grief journey is also flawed. Humanistic approaches recognize that all aspects of a client's experience, including their current coping strategies, are relevant and can offer valuable insights into their internal world and their relationship with their loss. Ignoring these aspects prevents a holistic understanding and can lead to superficial interventions. Professional reasoning. Professionals should employ a decision-making process that prioritizes active listening, empathy, and a non-judgmental stance. When a client presents with a coping mechanism that appears to be hindering their grief, the initial step is always to explore the client's perspective on this mechanism. This involves asking open-ended questions about their feelings, the purpose it serves, and their awareness of its impact. The GCC should then reflect these observations back to the client, allowing them to draw their own conclusions. Interventions should only be introduced collaboratively, and when the client expresses readiness or a desire for change, always respecting their autonomy and pace. This process ensures that interventions are client-driven and ethically sound, aligning with the core principles of humanistic counseling. Question 9. Risk assessment procedures indicate that a certified grief counselor, GCC, is working with a client whose family engages in elaborate, multi-day rituals involving specific songs, dances, and communal storytelling to honor the deceased. The client expresses distress not from the rituals themselves, but from the perceived lack of understanding and validation from their extended family, who are critical of the intensity and duration of these practices. The GCC must determine the most appropriate course of action to support the client's grieving process. Which of the following approaches best aligns with ethical and professional standards for grief counseling? Option A. Advise the client to gradually reduce the participation in these rituals to appease their extended family and minimize conflict, suggesting more conventional ways of mourning. Option B. Facilitate a dialogue between the client and their extended family, exploring the cultural significance of the rituals and the client's personal meaning derived from them, while also acknowledging the family's concerns about the intensity. Option C. Focus solely on the client's individual emotional state and coping mechanisms, without directly addressing the cultural practices or family dynamics, as these are outside the scope of individual grief counseling. Option D. Interpret the client's distress as a direct result of the rituals being inherently unhealthy or excessive, and recommend that the client cease participation to focus on individual emotional processing. The correct answer is B. Facilitate a dialogue between the client and their extended family, exploring the cultural significance of the rituals and the client's personal meaning derived from them, while also acknowledging the family's concerns about the intensity. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the Certified Grief Counselor, GCC, to navigate a client's grief expression that deviates significantly from commonly understood Western norms. The counselor must balance the imperative to provide culturally sensitive support with the risk of misinterpreting or invalidating the client's deeply held beliefs and practices. Failure to do so could lead to a rupture in the therapeutic alliance and further distress for the client. The GCC must exercise careful judgment to ensure interventions are respectful, effective, and aligned with the client's cultural framework. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing the client's cultural context as the primary lens for understanding and responding to their grief. This aligns with ethical guidelines for grief counseling that emphasize cultural humility and client-centered care. By actively seeking to understand the meaning behind the client's rituals and beliefs, the counselor respects the client's autonomy and validates their experience. This approach fosters trust and allows for the development of a therapeutic plan that is congruent with the client's worldview, thereby enhancing the potential for healing and integration. Incorrect approaches analysis. One incorrect approach involves dismissing the client's practices as irrational or a sign of pathology. This represents a significant ethical failure by imposing a Western biomedical model onto a culturally diverse experience, violating principles of cultural competence and respect for client beliefs. It risks alienating the client and hindering their grieving process. Another incorrect approach is to impose the counselor's own cultural understanding of grief onto the client, assuming that their own framework is universally applicable. This is an ethical breach of cultural insensitivity and a failure to adhere to client-centered care. It demonstrates a lack of professional development in understanding diverse grieving styles and can lead to ineffective and potentially harmful interventions. A further incorrect approach is to avoid engaging with the client's cultural practices altogether, perhaps out of fear of misinterpretation. While well-intentioned, this can be perceived by the client as a lack of genuine interest or understanding, potentially creating distance and preventing the counselor from offering truly relevant support. Ethically, it represents a missed opportunity to provide comprehensive and culturally attuned care. Professional reasoning. Professionals should employ a decision-making framework that begins with active listening and open-ended inquiry to understand the client's cultural background and its influence on their grief. This involves a commitment to ongoing learning and self-reflection regarding one's own cultural biases. When faced with unfamiliar grief expressions, the professional should prioritize seeking knowledge about the client's cultural norms and beliefs, ideally in collaboration with the client or culturally informed resources. The goal is to integrate this understanding into a therapeutic approach that is both evidence-informed and culturally congruent, always respecting the client's agency and lived experience. Question 10. The assessment process reveals a client who is experiencing profound sadness, anxiety, and a sense of detachment. They are aware that a significant loved one is terminally ill and anticipate the eventual death. The client expresses feelings of helplessness and a desire to prepare for what is coming, but also a sense of being overwhelmed by the prospect of the impending loss. Which of the following best describes the primary type of grief being experienced and the most appropriate initial therapeutic focus? Option A. Disenfranchised grief, focusing on validating the unacknowledged nature of the loss and seeking social support. Option B. Anticipatory grief, focusing on emotional processing of the impending loss and practical preparation strategies. Option C. Normal grief, focusing on acceptance of the loss and moving through the stages of mourning. Option D. Complicated grief, focusing on interventions to reduce prolonged intense sorrow and functional impairment. The correct answer is B. Anticipatory grief, focusing on emotional processing of the impending loss and practical preparation strategies. Explanation. This scenario is professionally challenging because it requires the Certified Grief Counselor, GCC, to accurately differentiate between distinct types of grief, each demanding a tailored therapeutic approach. Misidentification can lead to ineffective interventions, potentially exacerbating the client's distress and hindering their healing process. The GCC must apply their knowledge of grief typologies to understand the unique temporal and social dimensions of the client's experience. The correct approach represents best professional practice because it aligns with the ethical and professional standards expected of a GCC. By recognizing anticipatory grief, the counselor acknowledges the client's current emotional state and the impending loss, allowing for proactive support and preparation. This approach is grounded in the understanding that grief can begin before an actual death occurs, and that early intervention can be crucial. It respects the client's lived experience and validates their feelings, fostering trust and a strong therapeutic alliance, which are foundational to effective grief counseling. An incorrect approach that focuses solely on complicated grief would be professionally unacceptable. This would be a regulatory and ethical failure because it overlooks the specific context of impending loss. Complicated grief is characterized by persistent, intense sorrow that interferes with daily functioning and lasts for an extended period, typically beyond 6 months after the loss. Applying interventions for complicated grief prematurely, without evidence of its presence, could pathologize normal anticipatory grief and lead to unnecessary anxiety or misdirected treatment. Another incorrect approach that labels the grief as disenfranchised would also be a failure. Disenfranchised grief occurs when a loss is not openly acknowledged, socially sanctioned, or publicly mourned. While the client's grief might eventually become disenfranchised depending on the circumstances of the impending loss, focusing on this type of grief at the initial assessment, without clear indicators, is premature and misdirected. It fails to address the immediate reality of the client's situation and the specific nature of their anticipatory sorrow. The professional decision-making process for similar situations involves a thorough assessment that considers the temporal aspects of the loss, the client's subjective experience, and the social context. The GCC should ask clarifying questions about the client's awareness of the impending loss, their emotional responses to this knowledge, and any social support or lack thereof. This systematic evaluation allows for accurate diagnosis of the grief type and the development of an appropriate client-centered intervention plan that adheres to ethical guidelines and best practices in grief counseling. Question 11. The monitoring system demonstrates a certified grief counselor, GCC, is working with a client who, during a session, expresses significant despair and states, "I can't take this anymore. I think I need to end it all." What is the most ethically and professionally appropriate immediate course of action for the GCC? Option A. Reassure the client that their feelings are normal in grief and continue with the planned grief counseling session, focusing on coping strategies for loss. Option B. Document the client's statement in their file and schedule a follow-up appointment to discuss these feelings further in the next session. Option C. Inform the client that due to the severity of their statement, the GCC is unable to continue providing services and advise them to seek help elsewhere. Option D. Immediately initiate a crisis intervention protocol, including assessing the client's immediate risk and developing a safety plan, potentially involving emergency services if necessary. The correct answer is D. Immediately initiate a crisis intervention protocol, including assessing the client's immediate risk and developing a safety plan, potentially involving emergency services if necessary. Explanation. This scenario is professionally challenging because it requires the certified grief counselor, GCC, to navigate the complex emotional landscape of a client while adhering to strict ethical guidelines and professional standards. The GCC must balance empathy and support with the need for objective assessment and appropriate intervention, ensuring the client's well-being is paramount. The professional's duty of care extends to recognizing the limits of their expertise and knowing when to refer to other professionals. The correct approach represents best professional practice because it prioritizes the client's immediate safety and well-being by recognizing the severity of the client's expressed suicidal ideation. This aligns with the GCC's ethical obligation to prevent harm, a core tenet of grief counseling and professional practice. Promptly assessing the risk and implementing a safety plan, which may include involving emergency services or a mental health crisis team, is a direct application of this ethical duty. This proactive stance ensures the client receives the necessary level of care, even if it means temporarily stepping outside the typical scope of grief counseling to address an acute crisis. This is consistent with professional guidelines that mandate immediate action when a client expresses intent to harm themselves. An incorrect approach that involves solely offering continued grief support without addressing the immediate suicidal ideation fails to meet the ethical standard of preventing harm. This approach neglects the acute crisis and could have severe consequences for the client. It represents a failure to recognize the urgency of the situation and a potential violation of the GCC's duty of care. Another incorrect approach that involves immediately terminating services due to the client's expressed suicidal ideation is also professionally unacceptable. While a GCC may have limitations, abandonment of a client in crisis is unethical. The professional obligation is to ensure continuity of care, which might involve facilitating a referral to a more appropriate professional or service, rather than simply ending the therapeutic relationship without ensuring the client's safety. This constitutes a breach of ethical responsibility. A further incorrect approach that involves documenting the suicidal ideation but taking no immediate action beyond continuing standard grief counseling sessions is a critical failure. While documentation is important, it is insufficient when a client expresses a direct threat to their life. The ethical imperative is to act, not merely to record. This approach demonstrates a lack of understanding of crisis intervention protocols and a disregard for the immediate safety of the client. The professional decision-making process for similar situations should involve a clear protocol for crisis assessment and intervention. This includes 1. Active listening and empathic engagement to understand the client's distress. 2. Direct questioning about suicidal intent, plan, and means. 3. Immediate risk assessment based on the client's responses. 4. Development and implementation of a safety plan, which may involve hospitalization, crisis team involvement, or contacting emergency services if imminent danger is present. 5. Ensuring appropriate referral and follow-up care. 6. Thorough documentation of the assessment, interventions, and rationale. Question 12. Market research demonstrates that clients experiencing acute grief often exhibit negative thought patterns that can prolong distress. A certified grief counselor, GCC, is working with a client who is expressing strong beliefs about their own culpability in a loved one's death. The GCC recognizes these as potential cognitive distortions amenable to restructuring. The client, however, becomes visibly distressed when the counselor gently suggests exploring the evidence for these thoughts, stating, "You just don't understand how bad I feel and you're trying to tell me I'm wrong." How should the GCC proceed? Option A. Immediately shift to a different therapeutic modality, such as narrative therapy, to avoid further distressing the client and to explore their grief from a new perspective. Option B. Reassure the client that their feelings of guilt are a normal and expected part of grief, and that no further exploration of these thoughts is necessary at this time. Option C. Directly challenge the client's belief about their culpability by presenting objective evidence that contradicts their self-blame, emphasizing that their feelings of guilt are not based on reality. Option D. Acknowledge the client's distress and validate their feelings, then explain that the goal is not to invalidate their pain, but to explore how thoughts might be contributing to the intensity of their feelings, proposing to start by identifying specific thoughts and their emotional impact before challenging them. The correct answer is D. Acknowledge the client's distress and validate their feelings, then explain that the goal is not to invalidate their pain, but to explore how thoughts might be contributing to the intensity of their feelings, proposing to start by identifying specific thoughts and their emotional impact before challenging them. Explanation. This scenario is professionally challenging because it requires the certified grief counselor, GCC, to navigate the delicate balance between client autonomy and the ethical imperative to provide effective therapeutic interventions. The client's resistance to challenging their negative thought patterns, while understandable given their grief, presents a direct obstacle to progress in cognitive restructuring. Careful judgment is required to ensure that interventions are supportive and respectful of the client's emotional state, while still adhering to best practices in grief counseling. The correct approach represents best professional practice because it prioritizes a collaborative and client-centered application of cognitive restructuring. By first validating the client's feelings and then gently introducing the concept of how thoughts influence emotions, the counselor respects the client's current emotional landscape. This approach aligns with ethical guidelines for grief counseling, which emphasize empathy, non-judgment, and the establishment of a strong therapeutic alliance. The GCC is acting within their scope of practice by employing evidence-based techniques like cognitive restructuring, but doing so in a manner that is sensitive to the client's grief process. This respects the client's right to self-determination while guiding them towards potentially beneficial therapeutic outcomes. An incorrect approach that involves directly confronting the client's negative thoughts without adequate validation would be ethically problematic. This could be perceived as dismissive of their grief, potentially damaging the therapeutic relationship and increasing client distress. It fails to acknowledge the profound impact of grief on cognitive processes and may violate the ethical principle of beneficence by causing harm. Another incorrect approach, such as abandoning cognitive restructuring altogether due to initial resistance, would be a failure to provide competent care. While flexibility is important, a complete abandonment of a potentially beneficial technique without exploring modifications or alternative strategies would not align with the GCC's professional responsibility to offer appropriate interventions. This could be seen as a failure to uphold the duty of care. Professionals should employ a decision-making framework that begins with thorough assessment of the client's current emotional state and readiness for specific interventions. This should be followed by a clear explanation of the rationale behind proposed techniques, emphasizing their potential benefits and addressing any client concerns. When faced with resistance, the framework dictates a process of exploration, understanding the source of resistance, validating the client's feelings, and collaboratively adapting the intervention. This iterative process ensures that therapeutic decisions are informed, ethical, and client-centered, prioritizing the therapeutic alliance and the client's well-being. Question 13. System analysis indicates that a client experiencing prolonged and intense grief following a loss is expressing feelings of abandonment and a pervasive sense of worthlessness, which they relate to early childhood experiences of inconsistent parental care. As a certified grief counselor, GCC, how should you best approach this situation, considering the potential influence of psychodynamic theories on the client's current grief response? Option A. Interpret the client's feelings of abandonment and worthlessness as definitive evidence of a personality disorder, and recommend immediate referral for a full psychiatric evaluation without further exploration of their grief experience. Option B. Immediately focus on uncovering repressed childhood traumas and unconscious conflicts, as these are likely the primary drivers of the client's prolonged grief, and guide the client through deep psychodynamic interpretation. Option C. Acknowledge the client's current feelings of abandonment and worthlessness, and gently explore how these feelings, potentially rooted in earlier relational patterns, are impacting their current grief process, while remaining within the scope of grief counseling. Option D. Dismiss the client's connection to childhood experiences, asserting that grief counseling should solely focus on the immediate loss and coping mechanisms, and avoid any discussion of past relational dynamics. Correct answer is C. Acknowledge the client's current feelings of abandonment and worthlessness, and gently explore how these feelings, potentially rooted in earlier relational patterns, are impacting their current grief process, while remaining within the scope of grief counseling. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent complexity of grief, particularly when unconscious conflicts, as posited by psychodynamic theories, may be influencing a client's presentation. A certified grief counselor, GCC, must navigate the delicate balance between acknowledging the client's conscious experience of grief and exploring deeper, potentially unacknowledged psychological dynamics without overstepping professional boundaries or misinterpreting the client's distress. The GCC's role is to facilitate healing, not to engage in deep psychoanalysis, unless specifically trained and within the scope of practice. Correct approach analysis. The most appropriate approach involves acknowledging the client's stated feelings and experiences, while gently exploring how past relational patterns or unresolved conflicts might be manifesting in their current grief response. This aligns with psychodynamic principles by recognizing the influence of the past on present functioning, but it remains within the ethical and regulatory framework of grief counseling by focusing on the impact of these dynamics on the grief process itself. This approach respects the client's autonomy and lived experience, using psychodynamic concepts as a lens to understand the grief, rather than as a primary diagnostic or therapeutic modality for deep-seated personality issues. The GCC's responsibility is to support the grieving process, and understanding potential unconscious influences can inform this support without requiring the GCC to act as a psychotherapist, conducting extensive psychodynamic therapy. Incorrect approach is analysis. One incorrect approach would be to dismiss the client's stated feelings and immediately focus on uncovering repressed childhood traumas. This fails to validate the client's current experience of grief, potentially alienating them and violating ethical principles of client-centered care. It also misinterprets the GCC's scope of practice, venturing into territory typically reserved for licensed psychotherapists with specialized training in trauma and psychodynamic therapy. Another incorrect approach would be to rigidly adhere to a purely behavioral or cognitive model, ignoring any potential underlying emotional or relational dynamics that might be contributing to the client's prolonged or complicated grief. While these models have their place, a psychodynamic perspective suggests that such a narrow focus might miss crucial elements of the client's internal world that are impacting their ability to grieve effectively. This could be seen as a failure to provide comprehensive grief support. A third incorrect approach would be to engage in speculative interpretations of the client's unconscious motivations without sufficient evidence or client engagement. This can lead to misdiagnosis, damage the therapeutic alliance, and potentially cause harm by imposing an external narrative onto the client's experience. It also risks violating professional boundaries by acting as an interpreter of the unconscious rather than a facilitator of grief processing. Professional reasoning. Professionals should first actively listen to and validate the client's expressed grief. Then, they should consider how psychodynamic concepts might offer a framework for understanding the manifestation of grief, such as patterns of avoidance, idealization of the deceased, or difficulty with emotional expression, which could be linked to earlier relational experiences. The GCC should then gently explore these potential connections with the client, observing their response, and allowing the client to lead the depth of exploration. If the client's issues appear to extend beyond the scope of grief counseling and into deeper personality or trauma work, the professional should ethically consider referral to a more specialized mental health professional. Question 14. The performance metrics show a consistent pattern of clients expressing prolonged anger and denial regarding their loss, impacting their engagement with grief counseling services. A certified grief counselor, GCC, is reviewing these metrics and considering how to best address this trend. Which of the following approaches best reflects an understanding of the complexities of grief and appropriate intervention strategies within the GCC framework? Option A. Interpret the prolonged anger and denial solely through the lens of the Kubler-Ross model as a fixed sequence, and focus interventions exclusively on moving the client to the next predetermined stage. Option B. Focus on validating the client's anger and denial as natural expressions of grief, while gently exploring the underlying fears and the impact of the loss, and considering how these emotions might relate to the tasks of mourning and the stages of grief. Option C. Immediately attempt to guide the client towards acceptance and resolution, as prolonged anger and denial are seen as unproductive and indicative of resistance to the therapeutic process. Option D. Advise clients that anger and denial are stages that must be quickly overcome to achieve healing, and provide them with exercises designed to force them through these emotional states. The correct answer is B. Focus on validating the client's anger and denial as natural expressions of grief, while gently exploring the underlying fears and the impact of the loss, and considering how these emotions might relate to the tasks of mourning and the stages of grief. Explanation. The performance metrics show a consistent pattern of clients expressing prolonged anger and denial regarding their loss, impacting their engagement with grief counseling services. This scenario is professionally challenging because it requires the counselor to accurately assess the client's stage of grief and tailor interventions accordingly, while also adhering to the ethical principles of client-centered care and professional competence as outlined by the Certified Grief Counselor, GCC framework. Misinterpreting or misapplying grief models can lead to ineffective support, client frustration, and potential harm. The correct approach represents best professional practice because it demonstrates a nuanced understanding of grief as a non-linear process, acknowledging that individuals may cycle through stages or experience them concurrently. By recognizing that prolonged anger and denial can be a manifestation of the denial or anger stages of the Kubler-Ross model, or an indication that Worden's task of making the loss real is not yet fully addressed, the counselor can employ appropriate therapeutic techniques. This might involve validating the client's emotions, exploring the underlying fears associated with acceptance, and gently guiding them towards processing the reality of their loss without pushing them prematurely through stages. This aligns with the GCC's emphasis on evidence-based practice and client well-being. An incorrect approach that focuses solely on pushing the client towards acceptance without acknowledging the current emotional state would be a regulatory and ethical failure. This would violate the principle of respecting client autonomy and pacing the therapeutic process appropriately. It could also be considered a failure of competence if the counselor lacks the skills to address anger and denial effectively. Another incorrect approach, such as dismissing the client's anger as unproductive and demanding they move on, would be a significant ethical breach, demonstrating a lack of empathy and potentially re-traumatizing the client. This disregards the client's lived experience and the therapeutic alliance. Furthermore, an approach that solely relies on the Kubler-Ross model as a rigid, sequential path, ignoring the possibility of Worden's tasks being more relevant or the client's unique experience, would be a failure to apply grief theory with the necessary flexibility and client-specific consideration, potentially leading to ineffective interventions and a breach of professional duty of care. Professional decision-making in such situations requires a thorough assessment of the client's current emotional and cognitive state, a flexible application of established grief models, Kubler-Ross and Worden, and the selection of interventions that are both theoretically sound and client-centered. It involves active listening, empathy, and a willingness to adapt the therapeutic approach based on the client's responses, always prioritizing their well-being and progress at their own pace. Question 15. Operational review demonstrates that a client, recently bereaved by a sudden and unexpected loss, presents in acute emotional distress during a scheduled session. The client is expressing intense feelings of panic, hopelessness, and is reporting intrusive thoughts of self-harm, stating, "I can't go on like this." The Certified Grief Counselor, GCC, must determine the most appropriate immediate course of action. Option A. Immediately refer the client to a higher level of care, such as an emergency psychiatric evaluation, without conducting an initial assessment of their immediate safety or offering any immediate support, citing the severity of their statements. Option B. Immediately initiate a comprehensive safety assessment, validate the client's distress, and collaboratively develop a short-term safety plan that includes identifying immediate coping strategies and support contacts, while also exploring the client's immediate needs for stabilization. Option C. Provide the client with a list of general grief resources and coping strategies, and instruct them to review these independently before the next scheduled session, assuming they have the capacity to manage their crisis. Option D. Encourage the client to fully express all their emotions without interruption, believing that catharsis alone will alleviate the crisis, and schedule a follow-up appointment for the following week to discuss coping mechanisms. The correct answer is B. Immediately initiate a comprehensive safety assessment, validate the client's distress, and collaboratively develop a short-term safety plan that includes identifying immediate coping strategies and support contacts, while also exploring the client's immediate needs for stabilization. Explanation. This scenario presents a professional challenge due to the immediate and acute distress of the client, requiring rapid assessment and intervention while adhering to the Certified Grief Counselor, GCC, ethical guidelines and scope of practice. The counselor must balance the urgency of the crisis with the need for a structured, client-centered approach that prioritizes safety and immediate stabilization. The correct approach represents best professional practice because it aligns with the core principles of crisis intervention in grief counseling. This involves a systematic process of assessing immediate risk, providing emotional containment, and collaboratively developing a safety plan. It prioritizes the client's immediate well-being and autonomy by empowering them to identify coping strategies and support systems. This approach is ethically grounded in the GCC's commitment to client welfare, non-maleficence, and beneficence, ensuring that interventions are appropriate to the crisis state and do not exacerbate distress. It also respects the client's right to self-determination by involving them in the planning process. An incorrect approach that focuses solely on immediate emotional expression without assessing safety or developing a concrete plan fails to address the critical elements of crisis intervention. This could lead to further destabilization and potentially harmful outcomes, violating the ethical duty to protect the client. Another incorrect approach that involves imposing solutions or making decisions for the client, without their active participation, undermines their agency and can be perceived as disempowering, which is contrary to best practices in grief counseling and crisis support. Furthermore, An approach that delays intervention or refers the client without providing immediate support in a crisis situation could be seen as a failure to meet the client's urgent needs, potentially breaching ethical obligations to provide timely and appropriate care. Professionals should employ a decision-making framework that begins with a rapid risk assessment, suicidal ideation, homicidal ideation, ability to care for self. Following this, the focus shifts to establishing rapport and providing emotional validation and containment. The next step involves collaborative problem solving, where the counselor and client work together to identify immediate coping mechanisms and support resources. Finally, a safety plan is developed and reviewed, with clear steps for follow-up and ongoing support. This structured yet flexible approach ensures that immediate needs are met while laying the groundwork for continued therapeutic work. Question 16. Market research demonstrates that clients experiencing significant loss often present with a complex array of emotional, cognitive, and behavioral responses. A certified grief counselor, GCC, is working with a client who lost a spouse 6 months ago. The client reports persistent sadness, difficulty sleeping, and occasional intrusive thoughts about the deceased. The client also expresses feelings of guilt, believing they could have done more to prevent the death, and has withdrawn from most social activities. The GCC is considering how to best assess and potentially diagnose the client's current experience. Which of the following assessment approaches best aligns with professional standards for grief counseling? Option A. Primarily rely on the client's self-report of guilt and intrusive thoughts to determine the severity of their grief, assuming these are the most critical indicators of their current state. Option B. Focus on identifying specific diagnostic criteria for prolonged grief disorder based on the client's reported symptoms and the timeframe since the loss, and if met, proceed with treatment for that diagnosis. Option C. Immediately refer the client for a psychiatric evaluation to rule out major depressive disorder, as the reported symptoms of sadness and sleep disturbance are indicative of a more severe mental health condition. Option D. Conduct a comprehensive assessment that explores the client's subjective experience of grief, their cultural context, personal history, coping mechanisms, and the impact of the loss on their daily functioning, utilizing a combination of clinical interviewing and validated grief assessment tools before considering any diagnostic labels. The correct answer is B. Focus on identifying specific diagnostic criteria for prolonged grief disorder based on the client's reported symptoms and the timeframe since the loss, and if met, proceed with treatment for that diagnosis. Explanation. This scenario presents a professional challenge due to the inherent complexity of grief assessment and the potential for misdiagnosis, which can lead to inappropriate interventions and harm to the client. The certified grief counselor, GCC, must navigate the client's subjective experience while adhering to established diagnostic criteria and ethical guidelines to ensure accurate and effective support. The GCC's responsibility is to differentiate between normative grief reactions and more complex presentations that may require specialized attention, all within the bounds of their professional scope. The correct approach involves a comprehensive assessment that considers the client's cultural background, personal history, and the specific nature of their loss. This approach aligns with best professional practice by employing a multifaceted evaluation that utilizes validated assessment tools and clinical interviewing techniques. It prioritizes understanding the client's unique grief journey, acknowledging that grief is not a linear process and can manifest in diverse ways. This aligns with the ethical imperative to provide individualized care and to avoid premature or inaccurate labeling. The GCC's role is to facilitate healing, not to force a specific outcome or diagnosis that may not fit the client's reality. An incorrect approach would be to solely rely on a single symptom or a limited time frame to make a diagnosis. This fails to acknowledge the variability and chronicity of grief, potentially leading to mischaracterization of the client's experience as pathological when it is a natural, albeit difficult, response to loss. Such an approach could violate ethical principles by imposing external expectations onto the client's internal process and could lead to the denial of appropriate support if the client does not fit a narrow diagnostic mold. Another incorrect approach would be to immediately apply a diagnostic label without sufficient data or exploration, which bypasses the crucial assessment phase and risks misinterpreting the client's distress. This demonstrates a lack of clinical judgment and an ethical failure to conduct a thorough evaluation before forming conclusions. Professionals should employ a decision-making process that begins with establishing rapport and a safe therapeutic environment. This is followed by a systematic yet flexible assessment that gathers information about the loss, the client's coping mechanisms, support systems, and any pre-existing mental health conditions. The GCC should utilize a range of assessment methods, including standardized grief inventories and open-ended questions, to gain a holistic understanding. Differential diagnosis is crucial, considering other potential conditions that might co-occur with grief. Throughout the process, the GCC must remain attuned to the client's narrative and cultural context, ensuring that their assessment and any subsequent diagnostic considerations are client-centered and ethically sound. Question 17. Assessment of a certified grief counselor's response to a client who is tearfully expressing overwhelming feelings of loss and despair, stating, "I just don't know how I'm going to get through this," and is looking to the counselor for guidance. Which of the following responses best exemplifies active listening and empathy within the GCC's scope of practice? Option A. It sounds like you are feeling completely overwhelmed by this loss, and it's understandable to feel that way when facing such immense pain. I am here to listen and support you as you navigate these difficult emotions. Option B. I understand exactly how you feel. When I lost my own loved one, I found that focusing on my hobbies helped me immensely. You should try that. Option C. Let's make a plan to tackle this. We can break down your challenges into smaller, manageable steps, and I can help you create a schedule to get things done. Option D. You need to try and focus on the positive memories and remember that everything happens for a reason. You'll get through this if you just try to be strong. Correct answer is A. It sounds like you are feeling completely overwhelmed by this loss, and it's understandable to feel that way when facing such immense pain. I am here to listen and support you as you navigate these difficult emotions. Explanation. This scenario presents a professional challenge because the Certified Grief Counselor, GCC, must navigate a delicate balance between providing immediate emotional support and ensuring the client's long-term well-being, all while adhering to the ethical guidelines and scope of practice for grief counseling. The client's distress is palpable, and the temptation to offer direct advice or solutions can be strong, but this can inadvertently undermine the client's autonomy and the therapeutic process. Careful judgment is required to respond in a way that is both compassionate and professionally sound, respecting the client's pace and internal resources. The correct approach represents best professional practice because it prioritizes active listening and empathy, which are foundational to effective grief counseling. By reflecting the client's feelings and acknowledging their experience without judgment, the counselor validates their emotions and builds a trusting therapeutic alliance. This approach aligns with the ethical principles of beneficence and non-maleficence, ensuring that the counselor acts in the client's best interest and avoids causing harm. It also respects the client's dignity and autonomy by allowing them to explore their grief at their own pace and discover their own coping mechanisms. The GCC's role is to facilitate this process, not to direct it. An incorrect approach that involves offering immediate, concrete solutions or advice fails to acknowledge the complexity of grief. Grief is a process, not a problem to be solved with a quick fix. Offering solutions prematurely can invalidate the client's feelings, suggesting that their current emotional state is undesirable or needs to be fixed rather than experienced and processed. This can lead to the client feeling misunderstood or rushed, potentially hindering their ability to engage in deeper emotional work. Ethically, this approach could be seen as overstepping the boundaries of grief counseling by venturing into areas that might require different professional expertise, or by imposing the counselor's own beliefs about how grief should be managed. Another incorrect approach that involves minimizing the client's feelings or offering platitudes like "everything happens for a reason" is deeply problematic. This dismisses the client's pain and can create a sense of isolation. It suggests that the counselor is uncomfortable with the intensity of the client's emotions and is attempting to shut down the conversation rather than engage with it. This directly violates the ethical imperative to provide a safe and supportive space for clients to express their grief. Such responses can erode trust and damage the therapeutic relationship, making it difficult for the client to open up further. A third incorrect approach that involves sharing personal anecdotes about the counselor's own grief experiences, while potentially well-intentioned, can shift the focus away from the client and onto the counselor. While some limited self-disclosure can be appropriate in certain therapeutic contexts, in this situation, it risks making the client feel like their unique experience is being compared or overshadowed. The primary focus of grief counseling must remain on the client's journey. Ethically, this can be seen as a boundary violation, where the counselor's needs or experiences are inadvertently prioritized over the client's. The professional decision-making process for similar situations involves a continuous assessment of the client's needs and emotional state. The counselor should first focus on creating a safe and non-judgmental space, employing active listening to truly hear and understand the client's experience. Empathy is demonstrated by reflecting the client's emotions and validating their feelings. The counselor then considers their scope of practice and ethical obligations, ensuring that their interventions are appropriate for grief counseling and do not involve providing advice or solutions that are outside their expertise or the client's immediate need for emotional processing. The goal is to empower the client to navigate their grief, not to direct their path. Question 18. Comparative studies suggest that art and play therapy can be effective in helping individuals process grief, particularly younger clients. A certified grief counselor, GCC, is working with a 10-year-old who has recently lost a parent and is exhibiting withdrawal and difficulty verbalizing their feelings. Considering the client's age and presentation, which of the following represents the most ethically sound and professionally appropriate initial approach for the GCC? Option A. Advise the parents to encourage the child to be strong and focus on distracting activities, as direct engagement with grief at this age may be overwhelming and counterproductive. Option B. Immediately recommend that the child engage in journaling about their feelings, believing that verbal processing is the most direct route to grief resolution for all ages. Option C. Begin by introducing a structured art project designed to help the child express emotions related to loss, while also incorporating elements of play to create a safe and engaging environment for communication. Option D. Suggest that the child participate in a group therapy session focused on cognitive behavioral techniques, as these are widely recognized as the most effective for processing trauma and grief. The correct answer is C. Begin by introducing a structured art project designed to help the child express emotions related to loss, while also incorporating elements of play to create a safe and engaging environment for communication. Explanation. This scenario presents a professional challenge because a certified grief counselor, GCC, must select an appropriate therapeutic modality for a client experiencing profound grief, considering the client's age and developmental stage. The GCC must balance the client's needs with the ethical and regulatory guidelines governing grief counseling, specifically concerning the use of art and play therapy. The GCC's primary responsibility is to provide interventions that are evidence-based, client-centered, and within the scope of practice as defined by GCC certification standards and relevant professional ethical codes. The correct approach represents best professional practice because it prioritizes a comprehensive assessment of the client's needs and developmental stage before selecting an intervention. Art and play therapy are recognized modalities for facilitating emotional expression and processing in children and adolescents. By considering the client's age and the nature of their grief, the GCC ensures that the chosen therapeutic approach is developmentally appropriate and likely to be effective in supporting the grieving process. This aligns with ethical principles of beneficence and non-maleficence, ensuring the client receives care that is both helpful and safe. Furthermore, it reflects a commitment to client-centered practice, tailoring interventions to individual circumstances. An incorrect approach that involves immediately implementing a complex art therapy technique without assessing the client's readiness or developmental capacity would be professionally unacceptable. This could lead to frustration, overwhelm, or even re-traumatization if the client is not developmentally prepared for such an intervention. It would represent a failure to adhere to the principle of informed consent and client autonomy, as the client, or their guardian, has not been adequately informed about the rationale and suitability of the chosen method. Ethically, this bypasses the crucial step of assessment, which is foundational to effective and responsible counseling. Another incorrect approach would be to dismiss art and play therapy entirely based on a generalized belief that they are not serious, therapeutic interventions for grief. This demonstrates a lack of understanding of the evidence base supporting these modalities and a failure to consider a range of appropriate tools within the GCC's scope of practice. Such an approach could limit the client's access to potentially beneficial forms of support and would be a disservice to the client's unique grieving experience. It would also fail to uphold the GCC's ethical obligation to stay current with best practices and diverse therapeutic approaches. The professional decision-making process for similar situations should involve a systematic approach. 1. Comprehensive assessment. Thoroughly evaluate the client's grief, emotional state, developmental stage, cultural background, and personal preferences. 2. Consideration of modalities. Review evidence-based therapeutic approaches, including art and play therapy, considering their suitability for the client's specific needs and age. 3. Client collaboration. Discuss potential interventions with the client and their guardian if applicable, explaining the rationale, benefits, and potential risks, and seeking their informed consent. 4. Ethical and regulatory adherence. Ensure all chosen interventions align with GCC certification standards, professional ethical codes, and any applicable legal requirements. 5. Ongoing evaluation. Continuously monitor the client's progress and adjust therapeutic strategies as needed, remaining flexible and responsive to their evolving needs. Question 19. The control framework reveals that a certified grief counselor, GCC, is working with a client who, over several sessions, has increasingly expressed feelings of hopelessness, worthlessness, and has begun to verbalize thoughts of ending their life. The GCC has provided supportive counseling within their scope of practice, but the client's symptoms are escalating beyond what the GCC is trained or licensed to manage. What is the most appropriate and ethically sound course of action for the GCC? Option A. Immediately initiate a referral to a licensed mental health professional, such as a psychiatrist or psychologist, who can provide a higher level of care and assist the client in connecting with these services. Option B. Advise the client to seek professional help from a doctor or therapist on their own, and document that the client was informed of the need for further support. Option C. Discuss the client's suicidal ideation with other grief counselors in a peer support group to brainstorm potential strategies for managing the situation. Option D. Continue to provide grief counseling, focusing on coping strategies, and hope that the client's symptoms will improve with time and continued support. The correct answer is A. Immediately initiate a referral to a licensed mental health professional, such as a psychiatrist or psychologist, who can provide a higher level of care and assist the client in connecting with these services. Explanation. This scenario presents a professional challenge because the certified grief counselor, GCC, must navigate the delicate balance between providing immediate support and recognizing the limits of their expertise and scope of practice. The client's escalating symptoms of severe depression and suicidal ideation necessitate a referral to a higher level of care, which the GCC is not equipped to provide. Careful judgment is required to ensure the client receives appropriate and timely intervention without causing further distress or compromising professional boundaries. The correct approach represents best professional practice because it prioritizes client safety and well-being by initiating a prompt and appropriate referral to a qualified mental health professional. This aligns with the ethical imperative to act in the best interest of the client and to practice within the bounds of one's competence. The GCC's responsibility extends to ensuring continuity of care, which includes facilitating a smooth transition to a provider who can address the client's acute needs. This proactive referral demonstrates adherence to professional standards that mandate seeking appropriate consultation and collaboration when a client's needs exceed the counselor's scope of practice. An incorrect approach that involves attempting to manage the client's severe depression and suicidal ideation without immediate referral to a higher level of care would represent a significant ethical and potentially legal failure. This would constitute practicing outside the scope of competence, potentially endangering the client by delaying access to specialized treatment. Another incorrect approach, such as simply advising the client to seek help without providing concrete referral assistance or follow-up, fails to adequately ensure the client's safety and access to care, thereby neglecting the counselor's duty of care. A third incorrect approach, which might involve downplaying the severity of the client's symptoms or delaying the referral process due to personal discomfort or administrative concerns, would be a direct violation of ethical principles and a failure to uphold professional responsibility. The professional decision-making process for similar situations should involve a rapid assessment of the client's risk level. If the assessment indicates a risk of harm to self or others, the immediate priority is to ensure safety. This involves exploring options for immediate intervention, which may include crisis hotlines, emergency services, or direct referral to a psychiatrist or other mental health professional specializing in acute care. The counselor should document all assessments, interventions, and referral efforts thoroughly. Collaboration with supervisors or colleagues can also be invaluable in complex cases. The core principle is to always err on the side of caution when client safety is at stake, and to ensure that the client receives the most appropriate level of care available. Question 20. To address the challenge of differentiating between normal grief and complicated grief in a client who recently experienced a significant loss, which of the following assessment approaches would be most aligned with the ethical and professional standards expected of a certified grief counselor, GCC? Option A. Evaluating the duration and intensity of the client's grief symptoms, alongside their impact on daily functioning and the presence of specific risk factors for prolonged distress. Option B. Applying a standardized timeline for grief resolution, assuming any deviation indicates complicated grief, regardless of individual circumstances. Option C. Relying on the client's initial emotional expression to determine if their grief is excessive, without further investigation into the duration or functional impact. Option D. Dismissing the client's reported distress if it appears to be prolonged, based on the counselor's personal belief that grief should naturally resolve within a few months. The correct answer is A. Evaluating the duration and intensity of the client's grief symptoms, alongside their impact on daily functioning and the presence of specific risk factors for prolonged distress. Explanation. This scenario is professionally challenging because accurately distinguishing between normal grief responses and complicated grief requires nuanced clinical judgment. Misidentifying complicated grief can lead to unnecessary intervention, while failing to recognize it can result in a lack of essential support for individuals experiencing prolonged distress. The Certified Grief Counselor, GCC, certification emphasizes a commitment to ethical practice and adherence to established professional guidelines, which are paramount in this context. The correct approach represents best professional practice because it prioritizes a comprehensive, client-centered assessment that considers the duration, intensity, and functional impairment of grief symptoms. This aligns with the ethical imperative to provide competent and individualized care, ensuring that interventions are appropriate and evidence-based. Professional guidelines for grief counseling, as expected for GCC certification, stress the importance of a thorough risk assessment that considers the client's overall well-being and potential for recovery, rather than relying on superficial observations. An incorrect approach that focuses solely on the client's emotional expression without considering the temporal and functional aspects of their grief fails to meet the standards of professional assessment. This could lead to misdiagnosis and inappropriate treatment, potentially causing harm or delaying necessary support. Ethically, this approach neglects the counselor's responsibility to conduct a thorough evaluation and provide evidence-informed care. Another incorrect approach that relies on a predetermined timeline for grief resolution without individualizing the assessment is also professionally unacceptable. Grief is a highly personal process, and imposing rigid timelines disregards individual differences and the complexities of loss. This violates the ethical principle of respecting client autonomy and individuality. A further incorrect approach that dismisses the client's subjective experience based on the counselor's personal beliefs about grief is a significant ethical failure. Counselors must maintain objectivity and rely on professional knowledge and assessment tools, not personal biases, to guide their practice. This approach undermines the therapeutic relationship and the client's trust. The professional decision-making process for similar situations should involve a systematic approach. 1. Initiate a comprehensive assessment that includes gathering information about the nature of the loss, the client's history, their current emotional and functional state, and their support systems. 2. Utilize established diagnostic criteria and assessment tools for grief, considering factors such as the duration of symptoms, their intensity, and their impact on daily functioning. 3. Continuously monitor the client's progress and adjust the intervention plan as needed, always prioritizing the client's well-being and recovery. 4. Consult with supervisors or peers when encountering complex cases or uncertainty, ensuring adherence to ethical standards and best practices.